Louisiana parents have the right to decide whether their children receive vaccines for a variety of reasons. But with more kids not getting vaccinated, doctors warn that diseases that were virtually eradicated, like measles, are starting to make a comeback. Health organizations are documenting a global increase in measles cases. Measles is a viral infection that causes runny nose, fever, and a signature rash that covers the body. Children are the most susceptible, making up 44% of total cases in the U.S. The disease was considered eradicated in the 2000s, but health experts are slowly reporting more cases. Between January 2020 and March 2024, the CDC recorded 338 cases.
With the pandemic, things were really disrupted. Kids weren't necessarily going to school. So we saw a lot of disruptions in vaccination rates.
Charles Stecker is an associate professor emeritus at the Tulane School of Public Health and Tropical Medicine. He says that 93% of Louisiana's kids are vaccinated, but the percentage could be higher.
93%, that's at least an A- in my kids' grading school. But it's 2 percentage points short of that herd immunity threshold.
Louisiana Department of Health recorded 2 cases of measles this year, but the CDC records show that instances of parents opting their kids out of the vaccine process is growing.
Historically, Louisiana has had a pretty low rate of non-medical exemptions, we call them, among all states that allow philosophical exemptions to vaccines. But that's doubled in the last year. So suddenly we're on a quite worrisome trend.
The state requires all students to be vaccinated, but parents can request an exemption for medical, philosophical, or religious reasons.
It is not a vaccine-preventable disease.
To me, that's the main point of this bill.
A couple of bills in the legislature would make it even easier for parents to opt out. House Bill 46 will prevent schools from requiring COVID-19 vaccines. And House Bill 47 requires schools to communicate vaccine exemptions with information about vaccine requirements. Supporters of some of the bills cited health concerns.
First and foremost, there is lack of long-term data on the safety and efficacy of these vaccines, of the COVID-19 vaccine. We simply do not have enough information on the long-term effects of the vaccine. We have no 5, 10, or 15-year outcome reports. This is particularly concerning considering the potential impact on the developing bodies of children.
While others said parents have a right to know about their options.
Parents must be given all information about a medical intervention, including the fact that their child will not be denied an education should they refuse it.
As of now, information provided by the CDC shows that severe side effects to the COVID vaccine are extremely rare, with the benefits greatly outweighing the risks. Those who oppose these bills, like Crystal Rahman with the Louisiana Families for Vaccines, worries that the trend could lead to more outbreaks of other diseases.
Measles has the effect of wiping your body's immune system and not being able to be protected against diseases that you used to be protected against. So it's a very serious illness, and with decrease in, even a small decrease in vaccination rates, we'll see an increase of preventable tragedies.
Rahman says the only way to prevent a rollback of eradicated diseases is to make sure parents understand all of the information provided about vaccines. As of now, 81% of measles cases come from unvaccinated people, and over half of that percent were hospitalized.